Good day everyone, I am Hannah J. Olorenzo, student nurse from ISU Tiaga Main Campus, BSN 1-2, and today I will be assessing the mouth, throat, nose, and sinuses. I already performed hand washing. Now I will prepare all the necessary equipments. This includes gauze pads, cotton gauze pads, gloves, pen light, and a tongue depressor. And then explain the procedure to the patient. Good morning, ma'am. I am Hannah J. Lorenzo, your student nurse for today. So, can you kindly confirm your name, your age, and your birthday?
My name is Natalie Lee. My birthday is April 14 and I'm 12 years old.
Okay, how do you want me to call you, ma'am?
Natalie.
Okay, Ma'am Natalie, I am going to examine your mouth, throat, nose, and sinuses. So, and this assessment requires me to touch you. Is that okay with you, ma'am?
Yes.
Okay, this assessment, so the purpose of this is to verify whether there is a problem or there isn't. So I assure you that all the findings will be kept completely confidential. Okay, so let's proceed to the assessment. So first, I will assess your mouth. So I will inspect your lips, okay? Okay. So I observe that your lips are moist with no cracking, lesions, and swelling and have a homogeneous pink color. Okay? Next, I will inspect your teeth and mouth. So I'm going to use a pen light. So can you please open your mouth, ma'am? Okay, so I'm gonna count your teeth. Okay, so I have observed that you have 28 teeth. So that's normal because your wisdom tooth doesn't erupt yet. Okay, and your teeth is in a good condition. I didn't see any repairs such as crowns and any cosmetics. And your teeth color ranges from white to light yellow, and it has a shiny enamel and smooth surfaces and edges. So moving on, can you bite down your teeth like you are chewing something? Okay. Okay, so I have observed that your jaws are aligned with no deviations when biting. Next, I will just put on my gloves. And I will check your gums. Okay, can you please open your mouth, ma'am? Okay, open your mouth. Okay. So, I have inspected that the color and consistency of tissues along your cheeks and gums are even, which is good. Now I will inspect for your buccal mucosa, ma'am. Okay, so I will use a pen light and tongue depressor to retract your lips and cheeks. Okay, so can you please open your mouth? Okay, wide open. Okay. Okay, so I inspect that the tissues on your buccal mucosa appears moist and pink, and they are soft and pliable on palpation, and your stensils duct are visible with flow and saliva. So there are no redness and swelling in the area. Okay. Next, I will inspect and palpate your tongue. Okay, so can you please stick out your mouth, ma'am? Can you please stick out your mouth? Okay, stick out your mouth, like this. Okay, wide open. Okay, so thank you. So I observe that you have a pinkish, moist, moderate size with papillae present and slightly rough texture. So there are no presence of any lesions and fasciculations on your tongue. So now I will assess the ventral surface of your tongue, ma'am. So can you please touch your tongue on the rack of your mouth? Open your mouth, wide open, like that. Okay. Open your mouth. Okay, so can I palpate it now? Okay. Okay, thank you. So I assess that you have a prominent base on the ventral surface of your tongue. Your frenulum is in the midline, and there are under your tongue, and is pink, smooth, moist, and shiny, which is good. And I haven't observed any lesions. Now I will inspect for Wharton's duct, ma'am. So can you please open your mouth again? Relax your tongue, ma'am. Like that. Okay. So, so your Wharton's duct are visible, and there are also salivary flows and moistness in the area. There is no swelling and redness in your tongue, which is good. Okay, so next I will observe the sides of your tongue. So I'm gonna use a gauze pad to hold each side of your tongue. Can you please stick out your tongue, ma'am? Stick out more, like that. Okay. Okay, so thank you, ma'am. I observe that your tongue has no lesions, no ulcers or nodules that are apparent, which is good. So next is to check the strength of your tongue. So can I touch your cheeks, ma'am?
Yes, ma'am.
Okay, so I'll apply pressure on your cheeks and then resist it with the tip of your tongue. Okay, so on the right side. Okay, on the next side, the other side. Once more. Okay, so thank you, ma'am. So your tongue offers a strong resistance, which is good. Next is I will sprinkle something on your tongue. Then tell me how does it taste, okay? So stick out your tongue, ma'am. Okay. How does it taste, ma'am?
Sweet.
How does it taste?
Salty.
Okay, so thank you, ma'am. So you are right. So that means you can distinguish taste between salty and sweet, so which is good. Next is I will inspect for the hard and soft palate and uvula. So So can you please open your mouth, ma'am? Okay. So I see that your hard palate is pale or whitish with wrinkle-like folds. Your soft palate and uvula are whitish. Its surface is intact, movable, and smooth. I also don't see any lesions, and I have also noted that you don't have an unusual or foul odor, which is good. Next, I'll assess the uvula, so so I'll just stick this tongue depressor on your tongue, ma'am, and I will shine light on your uvula. So can you open your mouth, ma'am? Relax your tongue. Open your mouth wide open. Okay. Okay. So I assess that there are no redness or exudate that are present in your vulva. Okay, so I observe that the elevation of your uvula is in the midline and the elevation of your soft palate is symmetric. Next is I am going to inspect your tonsils. So I'll just place this tongue depressor on your tongue. So can you please open your mouth? Okay. So I inspect that your tonsils are pink and symmetric. Also, I didn't see any presence of exudate, swelling, lesions, which is good. Now I will inspect the pharyngeal wall. So open your mouth again. Okay. Wide open. Okay. Can you please relax your tongue, ma'am? Okay. So I have observed that your throat is pink and I didn't see any exudate and lesions. So I will just discard my gloves and perform hand hygiene again. Now we will move to the inspection and palpation of your nose. So I will just wear another clean gloves. So I have changed my gloves, ma'am. So let's start with the nose assessment. Okay, so first I will inspect and palpate your external nose. Okay. Okay, so tell me if you feel any tenderness. Okay. Do you feel any tenderness, ma'am?
No.
Okay, thank you. So I assess that the color of your nose is same as your facial skin, and your nasal structure is smooth and symmetric. So next, I will block one of your nostrils, and is it okay with you, ma'am?
Yes.
And you just have to sniff. Okay. Okay. Sniff. Sniff. Okay. So you are able to sniff through each nostrils while other is included with, which is good. Next, ma'am, I will inspect your internal nose. Okay, so I see enter the nose. Okay. I'll use a fan light. Okay. So, your nasal septum is intact and free from ulcers or perforations. Also, your turbinates are dark pink, moist and free from lesion. Lastly, your superior turbinate is not visible on my point of view, which is just normal. So finally, we will now move to the last part of the assessment, which is your sinuses. Okay, so first I will palpate the frontal sinuses. Okay, is that okay with you, ma'am?
Yes, ma'am.
Okay. So, do you feel any tenderness?
No.
Next, I will palpate your maxillary sinuses. Okay, do you feel any tenderness, ma'am?
No, ma'am.
Okay, thank you, ma'am. So your frontal and maxillary sinuses are non-tender in palpation and no crepitus is evident. So next is I will lightly tap over your frontal and maxillary sinuses. Is that okay with you, ma'am?
Yes, ma'am.
Okay. Okay, do you feel any tenderness?
No, ma'am.
How about that? How about this one? Do you
No,
feel any
ma'am.
tenderness? Okay. So thank you po. So your sinuses are not tender on percussions. And lastly, ma'am, I will shine light to your sinuses. So I will just darken the room. So give me a minute. Okay. So I will shine light to your sinuses. Okay, can you please? Okay, so thank you. So I observed that the light shine through your tissues and it appear as reddish glow over your sinuses, which is good. So that's all for our assessment, ma'am. So thank you so much. I will just write down the other information and findings. Just wait for a minute. Okay, so do you have any other questions, ma'am? Okay, so that's all for our assessment for your mouth, throat, sinuses, and nose. So thank you again, ma'am.